Okay, well, we might get started. I'm conscious that there's not just the people in the room, but there's also people watching on the live stream. So we'll try to kick off on time. My name's Ben Harris-Roxas, and I'm from the Centre for Primary Healthcare and Equity at the University of New South Wales. So this CPHCE is a research centre that does a lot of work on healthy cities work, healthy built environment work, health impact assessment, and has done intersectoral action for work for more than 20 years, really. So we're located across multiple sites, including in the southwest of Sydney through the Chetra hub, Hurdu in Sydney Local Health District, and Search in southeastern local health district. So today we're going to be talking about working with local government to create healthy landscapes, lifestyles and livelihoods. Before we start, I'd like to acknowledge the traditional owners on the land we're meeting on, who are the Cadigal people of the Eora Nation, and to acknowledge elders past and present and any Aboriginal people here today. Importantly, you know, this always was, always will be Aboriginal land. Today we're going to be talking about how really local government and health work together to create many of the preconditions for health. You can see that many of the factors that determine our health are shaped and mediated through local government, our local economies, our local environments, our local social conditions. So really what we're going to be talking about today is some of the experiences from Sydney, but also internationally, about how we can do that using tools like health impact assessment, but also other approaches to really add value to both the work of local and city governments and the health sector. We're fortunate today to have Tierno Diallo joining us, who's currently a researcher in Quebec. Tierno is a postdoctoral researcher at the Université Laval, and he completed his doctorate on the use of health impact assessment to address climate change at the University of Geneva. He's chair of the Global Working Group on Health Impact Assessment for the International Union for Health Promotion and Education, and his current research is focusing on the consideration of health impacts at the municipal level and involves working closely with Quebec City and the Regional Public Health Authority and the Quebec National Institute for Public Health. So he'll speak a bit more about that today, and then we'll follow that with some other speakers and a panel discussion. So, Tierno, welcome.
Good morning, or bon matin, as we said in Quebec City. First of all, I would like to say that I apologize for my French accent, but I hope you will be able to understand what I'm saying. I haven't had too much time to practice my English here since I arrived 2 days ago. And I would like also to thank a lot Ben for organizing that seminar on HIA. That reminds me our international conference on HIA. Last time was in Geneva in 2013. It's been a while. But this is a type of subject that we can discuss during a teleconference of the Global Working Group. And I have to say that I'm very, very happy to be here. I'm pleased to be here because the fall season is much more comfortable than the one we have in Quebec City. I hope there are no Canadians in this room because I want to make sure that I will be able to go back there. And thanks a lot for inviting me. Ben asked me to talk about the work we are doing right now on HIA in Quebec City. Actually, I had the opportunity to meet a colleague from University of Geneva because I made a stop in Geneva before coming here. I met Jean Simos of the University of Geneva, and he gave me an update of the situation about HIA in Switzerland, and I have also a quick overview of what's going on in France about also HIA. I hope I will stay within the time. I'm sorry if I use too much time, but I will try to do the best. Let's see. Maybe not. Oh, no. Yeah. I will start by talking about what we are doing right now in Quebec City. Actually, I arrived in Quebec City in 2016, which is quite very soon because I was in Geneva before. And after that, I will talk about what's going on in France and also in Switzerland, but that will be a short, quite quick overview. I guess that most of you here knows where is Quebec City, but just to be sure, it's the northeast of Montreal. Montreal is the biggest city of the province of Quebec, and Quebec City, the second largest city, is also the capital of the province. And actually, it's the first, and it's not the first province who started to work on HIA. It was the British Columbia started working on HIA, but after that they stopped, and then Quebec City started working on it. But Quebec City has done many HIA, and we'll talk about, no, not Quebec City, Quebec province has done many HIA, and we'll talk about that. I have to say that I arrived in Quebec City in a very, very favorable context for HIA development, and I was very happy to know that. But I don't know for how long the situation will be like this. Hopefully for a long time. But right now we are happy to have many documents related to public health, mentioning explicitly the use of HIA at the municipal level. We have the public health program for 2015 to 2025. We have also the new policy on health promotion at the provincial level, also explaining clearly to use HIA at the municipal level. We have also the regional public health action. This is for the health sanitary region at the Quebec City level, and also we have another kind of interdepartmental action plan. I know that some of you know Louis Saint-Pierre. Louis Saint-Pierre was working on that action plan for 2017 to 2021, and there is an important aspect related to HIA there. The main finding is, as I said, is a very favorable context to promote the creation of healthy environment, and also Quebec municipalities, in the province, still have limited responsibilities regarding the health of the population. This is a type of difficulties that we are having, trying to implement HIA. And also public health and urban planning sector are structurally set in silo. I guess that also we have the same situation here. And this is also another difficulty that we are facing right now. I'm not going to spend too much time about the Ottawa Charter, but yes, this is how things are working right now. But fortunately, by using HIA, we are trying to have some brief with urban planning and public health, and I'm going to give you some examples. I won't be able to go to have a full presentation of each case study that I'm going to mention because of lack of time, but I can send you, if you want, the link. Unfortunately, all the reports are in French, but I can send you the link if you are interested in seeing that. Yeah, still very strong. And actually, the objective that we have in Quebec City right now is to try to carry out or to perform different HIAs at different scales, regional, local, and state, with the existing urban planning process in partnership with the City of Quebec, and also to try to build a regional intersectoral capacity and like kind of HIA community of practice we are trying to build. And also we will do exactly what has been done here in Australia and also in New Zealand to try to evaluate the effectiveness of HIA. We are thinking about doing that in Quebec City since we are working on HIA for almost 5 years. And yes, this is the three main objectives that we have right now. And here is our kind of HIA model, if I have to call that like this. You see, this is the city. Okay, this is the City of Quebec, and the City of Quebec proposes some projects, several projects, and after that, we have a kind of steering committee, which the role of this committee is to try to do the screening step. In other words, is trying to see which projects will require an HIA. And that steering committee is composed of representatives of 2 members of the city, Quebec City, 2 representatives of the regional public health authorities, and 1 from a kind of public organization called Vivonville, and 2 from the university, Laval University, including myself, and 1 from the National Collaborating Center for Healthy Public Policy, which is Louis Saint-Pierre, and also a private company called Développement Santé. Développement Santé is actually it's a company which has been built by former master student who has taken HIA classes at the University Laval, and they were very happy about what they have learned, and they decided to create their own company, and they are now helping municipalities and public administration, doing HIA, and they are also helping us in our work. Then when the city proposes projects, we are doing here what we call the screening, and then we select like 2 or 3 projects, and for each project we have a kind of working group, and the members of the working group are representatives from each organization here. They are in the members of the working group, and the working group will do what we call the scoping. Also,
I'll just get you to hold the microphone.
Oh yeah, thank you. Yeah, they do the scoping and also the appraisal and reporting, and after that, we will do what we call the evaluation of the whole process. This is how we work in Quebec City. It's really simple. It's easy. Actually, we are having very good result right now, and I hope it will be the same in the future. And you see, it's not so many members in the model. It's just the city and the public health authorities and the university. But this is a model which has been initiated by the university. We have another model in the province of Quebec from another region called Montérégie. Émile Tremblay is working on that, and is different from the model that we have in Quebec City. This means that HIA is a flexible tool, because in the same province we have different models for implementing HIA. And in the Montérégie region, it's not an initiative from the university. It's an initiative from the public health authorities. And here in Quebec City, the initiative is from Université Laval. My supervisor, Professor Alexandre Lebel, was very involved in HIA development in Quebec City. Now I'm going to give some examples of HIA that we have done. As I said, I cannot make a full presentation of the case studies for lack of time, but I will try to give you, some key points of the result of our HIA. This is Quebec City. Sorry, some slides are in French, but I will try to translate them. And this is the study area of that HIA, which has been done by students at master degree student at University Laval. And this is the study area of the project, and it's located in the edge of 3 neighborhoods and 2 boroughs, and also it's an important crossing point. Actually, when I arrived in 2016, we were the HIA was just starting here, and then I worked on also this HIA, and this is what we call the logic model. We are trying to see the link between the projects. This is the project, and the quality of life. We are not stopping at the health impact, but we are going until the quality of life. This is the determinant of health, social network, housing, air quality, noise. This is a kind of mobility, transport, safety. This type of determinant that we have an urban planning project, and we are making the link between physical health and mental health. And this is the appraisal step. I'm going to show you how we do the appraisal step. The first stage that we do is to try to have a description of the initial state. We are not trying to evaluate the initial state, but we need to have information about the initial state. And this is our first step. And the second step is trying to determine the link between the project and the determinant of health by trying to see the potential impact of the project on the determinant of health. And the third step is the potential health impact or the possible health impact of the project on health. Then we're going to formulate some recommendation. This is how we do the appraisal step. This is how we present the result to the decision makers and also to the members of the working group. You can see here in this table, this is the objective of the project, because we are working on the objective of this project. There are kind of a lot of objectives, and then we are trying to see if it will be positive, negatives, or maybe there is no impact, or we don't have enough information, to say it's positive or not. This triangle, in fact, that was when I arrived here in Quebec City that I gave them that's the way how they can, categorize the potential negative impact. Because I remember that when I was in France, I was doing an HIA on a school building project, and I presented the result of that HIA to the mayor of the city, and I showed him the possible positive impact of the project and also the possible negative impact. After my presentation, he said, "Oh, Mr. Diallo, thank you very much for that nice presentation, but I'm not gonna present to the community a potential negative impact of my project. No, you have to find another way of, showing negative impact." I said, one of the key value of HIA is transparency. I cannot hide my results by saying all the impact are positive. He said, I'm not going to present that to the community. You have to find a solution. Then I decided to put that triangle, and I say it's a warning. But actually, I know that's a negative impact, But he will be very comfortable with that, and I said, okay, no problem. I know that's the negative impact. He knows that's but he's going with that, you see. Then that's why when I arrived in Quebec City, we decided, to do something like that. And yeah, this is the type of result. Which is very interesting here. This is the number of accidents involving pedestrian or cyclist bikers with car driver. And the big one here, this one, is between the Ministry of Health and the hospital. I don't know for why, what is the reason, but it was kind of very fun to have this one here. But this is the situation, and this type of information that you used to give to the decision makers. And this is very useful because they can see exactly where are the problems and where they have to find a solution. And we are going to see if the project is going to improve that situation or not. Yeah. Let's see another example. Yeah, this is for accessibility to public services and groceries. And what you see here is the percentage of renters which for paying more than 30% of their income for housing. Yeah, you have like 30%, between 20 to 30% of the people living in the study area who pay more than 30% of their income for housing. This is the proportion of people 55 and older living in the study area. This information is very important in the HIA because we know that where are vulnerable people, for housing and something like that, and we know where is elderly people, etc. And we're gonna use that formulate some recommendations. And this is also another map about access to park in the study area. You see, in green we have the park here, and we are trying to see the access. And also you have the same here for access to grocery, and this type of information that we use in our HIA. And here is the summary of the results. You have here all the objective of the project. You have in this column the objective of the project, and the row here is the determinant of health. And what we are going to see with this table is to see if like this objective has a positive or negative or neutral impact on health, and then we are trying to have a kind of measure of the global impact, which is quite very interesting, just to see if it's kind of very positive impact or negative impact. Is a way on how we present our result. This is how we present the recommendations. You still have here the list of, here is the list of the recommendation from this HIA, and what we are going to do here with this table is to see if this recommendation, which has been formulated for this determinant of health who is housing, will also affect another determinant of health, like social network. But this table is very interesting, but it could be very dangerous, because some decision makers, they can say, okay, I'm going to just implement this one because this one is going to touch all the determinant of health, and the other one I don't care about. Then you have to be careful with this type of representation, even though it's very interesting. But they don't have to know that I'm going to choose this recommendation because this recommendation is going to touch several determinants of health. Yeah, but it's a way to see which recommendation can have several impact on determinant of health. This is another way how we present our result. And that was the team has carried out that HIA. Alexandre Lebel is the professor and his student, and I was kind of supporting the student for doing that HIA. Quickly, another example is another project in Quebec City. This is about building housing also in almost the CBD area, not close to the CBD area. And you see, this is the information that we collected from the urban planners of the city. And here, yeah, this is the study area that we are seeing here. And yeah, that gives us the global concept of the projects with green spaces and also network cycling, and yeah, this is for green spaces. Another example of logic models that we are using. This is the project. This is the determinant of health. It's the same: air quality, green spaces, food, mobility, and also the potential impact on health. And you see here, it's about quality of life. We are always going through the quality of life. And this is the type of result that we got. We are seeing if actually there is a compliance with what we have in the legislation or what we have in some important documents like report from the National Public Health in Quebec, and see if the project is in compliance with that or not. And yeah, that was before I arrived. You see here, it's not a triangle, it's just minus, then negative impact. When I arrived in Quebec, we decided to change it, but it's a kind of summary of the result, and you have a global view of what was the result of the HIA. And this is how we represent our recommendation. Here you have the map of the project, and you see, this is an example of recommendation that we have formulated. Some of them have been integrated into the project, but the other one no. And yeah, this is also we are still talking about how we we formulate our recommendations. And as you, let's see, going back, yeah, here is about a building which is kind of having possible urban canyon. We have to revise the distance. Actually, we did an HIA in 2000, at the beginning of this year, and we were able to convince the urban planner to change the orientation of the buildings. Yeah, that was a main result of that HIA. And they agreed because they were a member of the working group. And then we gave them some very good arguments, and we convinced them to change the orientation of the buildings. And how was HIA useful? Was it used only at the internal level? Many decisions were already taken for that HIA, but for that project. But the HIA helped. Yeah, 5 minutes. Okay. The HIA helped us, trying to reinforce that decision. And how was the HIA process appreciated? Actually, it's very, very appreciated right now in the city of Quebec by urban planners, but also by decision makers, because we have a simple models, and the city is completely involved in the process, and also there is a kind of partnership with the city and the public health authorities. It's a new type of collaboration between them. They used to collaborate, but not too much. By using HIA, we are trying to strengthen the collaboration between the public health authorities and also the city of Quebec. And yeah, that was the theme. Let's go. Okay, this is the list of the HIA which has been done in Quebec City until now. Currently, we have 3 HIA undertaken right now in Quebec, and also we will be trying to evaluate in fall the whole process to see if it was positive, very positive, and what type of result we got. Private promoter used the HIA report to negotiate with other institutions. They were involved in the working group, the private promoter. I haven't seen something like that when I was in Switzerland. Even though the HIA that I have been done in France, the private promoter were not directly involved. But in Quebec City, they were directly involved. That's why they accept to modify some things in their projects. And also the creation of that private company called Development Santé, that was another result. The HIA was used in public consultation, and also the development of an intersectoral community of practice working between different sectors, and the initiative also new positive intersectoral collaboration between the city administration. I was already talking about that. Already contribute to a change of current practice. Yes, because now when an urban planner from the city is working on a project, even though we are not working with him, he is always thinking about the link between his project and the determinant of health. He's making his own reflection about that. We don't need to be here to help him do that, because he has already been involved in an HIA process. And he remember that his project can affect some determinant of health. And this is a very interesting result. And the implementation of HIA in the urban planning process contributed to the completion of the training of many urban planning master students. Yeah, because at Laval University, we have a kind of master degree, and we have a course called Public Health in Urban Planning. And in that course, we have an HIA training for the student. Now we are, training students about how to use HIA, and this is a very good also result at the academic level. And quickly, what's going on in France? The first HIA was done in 2008, and now between 2008 and now they have like 20 HIA which has been done, almost 20 HIA. I think they have more than that. And most of them has been done by the French School of Public Health in Rennes, Jean Simos and Anne-Roy Legal. And you see, this is the HIA which has been done in France. Most of them is from the urban planning sector, like what we are doing in Quebec City, but it's not the same in Switzerland, because in Switzerland we have a more variety of HIA which has been done, not only in the urban planning sectors. And right now, the High Council for Public Health was commissioned to reflect on the consideration of HIA in land planning documents at the national level. Jean Simos was leading that group, and some recommendation of the High Council for Public Health was about HIA. I just give you some example here. You can see if you want to download the report, here is the link. It's a very interesting study that has been done at the national level by the French countries. And here is the situation in Switzerland. In fact, what happened in Switzerland is when the Swiss Parliament rejected the Health Promotion Act in 2012, we had at that time an association, an HIA association. But the General Assembly of the HIA Association decided the dissolution of the association and to create two committees, one scientific committee and one political committee. The scientific committee is under the leadership of the University of Geneva. They are working on training people regarding HIA, on doing HIA, and about knowledge transfer, etc., etc. And the political committee is at the federal level. They are working on promoting the approach of taking into account the determinant of health. They are not directly speaking about HIA. They are more speaking about health in all policies. And it's a bit different. This is the situation right now in Switzerland. And I think that's my last slide. Yeah. Here are all the partners that we have in Quebec City. Louis Saint-Pierre, people from the Public Health Office, and people from the city, and also from the university. And here are the funding partners that we have right now. Thank you.
Thanks so much, Tierno. We have a few minutes for questions. If anyone has any follow-up questions, that was a great recap of not only what's happening in Quebec, but in all the French-speaking world in this area. And if anyone has any questions, please let us know. And I would encourage you to ask questions. We can save statements for when there's a panel discussion later on. Yeah.
Hi there, I'm one of these urban planners. I noticed the time frames are still quite, I guess, lengthy. Do you find that's a barrier at all in any of the experience that you've had of people wanting to do HIAs? It's a barrier to those other processes that have their own time frames?
Yeah, actually, we still have, we are really relying on the flexibility of the tool. You see, since the tool is flexible, we are trying to overcome this problem by offering different situations of HIA. We are trying to do rapid HIA, we are trying to do complete HIA, we are trying to do intermediate HIA. It depends on the resources that we have, and also it depends on how really people want to get involved in the process. As I presented here, you haven't seen like the community participation in our HIA, because always that questions that they're asking me that question: where is the community in your HIA? What we are right now doing is actually we are trying to collect the data from the city, because the city usually organizes public consultations. And we use that public consultation in our HIA. And we use also, we can do some interview with vulnerable people to complete this information, because the time that sometimes we have for doing HIA is too short. It's really too short, and we don't have enough time to bring people in the HIA process. Then we are trying, to deal with that situation by using different model of HIAs. Yeah, I don't know if I answered your questions. Yeah.
Any other questions?
As you know, I was recently visiting Canada, much colder then. But one thing that I was impressed with in both your place and Montreal is the employment of town planners as part of the HIA teams.
Yeah.
And I think that actually puts a different spin on the whole presentation of the work. That once you've got town planners in the room, there seems to be a slightly different flavour. And I thought that was a very positive flavour, and I would like to think we could move towards that as well.
Yeah, sure. I totally agree with you. Yeah.
I'll take that as a comment.
Yeah, I take it like it.
Hi, my name's Vanessa. I just am interested in your perspective, you know, globally. Is Quebec a bit of a leader in terms of HIA in local government? Is that?
Right now, you are talking about the province level or the city? Because the situation right now in the province is that we have like 18 health sanitary regions in the province of Quebec. And just 2 regions are working on HIA. The Montérégie region and the Capitale Nationale, Quebec City region. And the other one are not working on HIA for different reasons. Problem of resources, problem of time, human resources, financial resources. And Montérégie was the first one who were working on HIA. I think it started in 2007. Until now, they are still working on HIA. But with municipalities. But the difference with Quebec City is the only municipalities in the province of Quebec which has done more than one HIA. Because in Montérégie, what is going on is that they have several municipalities in the region of Montérégie, like more than 100, and they are always working with one. They work with this one, and then next year they work with another one, etc., etc. But they don't have what we have in Quebec City, like the same municipality has done many, many other HIA. And why the situation is like this is because the Université Laval taken this initiative to try to, to create a kind of bridge between the public health authorities and the city of Quebec. That's why we have this type of partnership. But I think that with all those new documents that we have right now in the province, like the public health program or the governmental policy on health promotion, many other municipalities and health sanitary region will start working on HIA. Yeah, because we will organize like trainings, and then they have now 2 experiences from Montérégie region and also from Quebec City region. Then I think they will be working on HIA. Yeah.
That's a great answer, and actually leads nicely to our next presentation. So thanks very much, Leonora. That's fantastic. Our next presenters will be speaking about a Sydney experience. So I'd like to invite Maria and Tina and Carolyn to come up. Maria's manager of business and collaboration within the Healthy People and Places unit in South West Sydney Local Health District. Tina's team leader for communication and community engagement. Is it engagement? Sorry, wrong. Okay. And Carolyn's team leader for strategic planning. So they'll be talking about experiences in Wallandilly, which is local government in the southwest of Sydney, that really marries the best bits of a rural and urban setting, but also faces some challenges in managing the coming together of those 2 environments. So who'll lead off?
I'll lead.
Yep.
Thank you for inviting us to talk today. We are very excited to also through you. I'm
Population Health, we've been doing HIAs for since 2007. The Ministry of Health was funding us to do HIAs in the beginning, and Population Health in South West Sydney believed that it was such a good tool for us to use that we decided to start funding it in 2009. So this was before my time. I started in 2012 in Population Health. But before that, they were doing a lot of HIAs. So we've got a range of HIAs that we've done, which you're very welcome to look at our website and see our reports that we've developed in the past. So since 2009, we did a range, like I said, hospital redevelopments, obesity plans, so a variety. So we ended up engaging Tetra to do a lot of our training, so our learning by doing training. We often do that every second or third year. The first one the one that we did with Wallandilly Council, which was in 2012-13, it was a learning by doing kind of model. And the learning by doing, I don't know if you've heard of that before, but it's a really good model where you actually do the training. It's a 3 to 4 day full day training, not consecutive days, over a period of a couple of months. But you actually do an actual HIA. So that's what's called learning by doing. It's a really good tool because that's when you actually end up being with other people on the team where you actually do the HIA together. It is challenging, and we can definitely say that it was very, very challenging, but I think that's what helped us build our partnership, because it did take us a whole year to do the HIA, and we laugh about all the time. But I think that's what brought us together, that we almost feel like a team. We don't really feel like when we get together that like we're health and their council, because we just kind of like feel like we're just working together to do work for our community, which is really good. So this year we're doing a learning by doing training. We're starting another set of training in about July, August. But this year we're definitely just going to be focusing on local councils, because often we have like people from housing or education, within the hospital setting or within population health. But this year we've decided to focus on actually our councils within our local health district. So we've got 7 local councils that we're inviting, and I'm spending lots of time with them to do a bit of, pre-scoping and getting ideas of where they want to do their HIAs on. So what we've decided is we're going to have certain groups all in council, and then we're going to have people from health, the PHNs, to actually sit in all the groups. And this is how we found that it's been working really well. So having HIAs with a variety of different people, it works fantastic because you have lots of different experience and ideas. Okay, I think I'll hand over next. So we're just going to more talk, shows our partnership. Oh, I've got to change the slide.
So when Health met Wallandilly, how did we get here? Well, as Maria said, there was this opportunity to do some training, and at the same time, Council had asked the local health district to comment on the Wilton Junction master plan, and that was a proposal, it is a proposal, to develop a new town of 50,000 people, which would be effectively doubling the population of the Shire. So a huge potential impact. Council jumped at the opportunity to do the training and thought that doing Wilton Junction as our project would be the perfect opportunity to have a look at how we could really make Wilton potentially a really great place to live, not just a place to live. And we're still working on that at the moment. Part of the submission that the local health district submitted was, let's do the HIA, and then we looked at Wilton, so that's how we came to it. Council was really open to this, so we formed a team, and that team was multidisciplinary. We had land use planners, strategic planners, we had people from health and recreation, we had people from community services like myself. We had quite a mix of experience, which was good both in terms of our relationship with health and then getting to know how council operated and what were some of the silos within our organisation as well as health. So we developed relationships both internally and externally. I got to know the land use planners a lot better and what the things they were up against in terms of incorporating health into the things they were doing. So it was a really positive experience, and as I said, it took us a long time. And we'll talk about some of the challenges later, but and because it did, we formed those relationships. We understood where each other are coming from, and if we did it again, we'd probably do it differently, but I think we don't regret it at all. Move on to the next. Oh,
So I guess how have we moved on from our health impact assessment that we undertook? I guess it's like what you were saying earlier, having planners in the room possibly changed the dynamic, and a lot of the recommendations that were being discussed for our health impact assessment, us planners were sort of saying, you can't do that, there's no way you can do that. So it sort of forced us to speak a little bit more and just that broader conversation of, well, how do you change, I guess, health outcomes when you plan? So that question for us led to the Director of Population Health contacting our General Manager to have, I guess, to invite him to have that conversation about exploring ways that we could potentially collaborate together and look into that idea a bit more. So that meeting happened and we identified some opportunities, where we could maybe do a health impact assessment, how broad we were looking, not just land use planning policies, but all the sort of suite of policies that local governments have. And from that, in November 2015, we held a health and planning forum at Council. And so that involved members from Council from all disciplines, directors, managers, in transport planning, community engagement, urban planning, and a whole suite of experts from the health sector as well. And out of that forum, again, came some ideas, sharing ideas and knowledge and that sort of thing. And I guess in terms of where we are at, there are some particular opportunities identified for land use planning. So since then, we've undertaken 2 research projects. The research has been undertaken by CHETRA and funded by the local health district. The first one, which has been completed, was just looking for where those intervention points are in council's processes, and with a bit of an eye of being able to replicate that in other councils, because that's important for the health service. And at the moment, we're underway with a health assessment protocol. So that's looking in detail at the strategic and the more detailed design processes for planning and what models we can use specifically to incorporate health into our decision making.
Okay, we've got about 3 minutes left, so we better quickly talk, girls. Okay, so embedding the partnership. So we really thought, how can we embed it into practice? Because, staff turnovers can happen, anything can happen, GMs and directors can change. So we wanted to embed our partnership into council and health. So we decided that Wallandilly have a health alliance already. So we thought that we would become a health in planning, which is called the HIP, which Peter at the back and I co-chair. It's a committee a working group that actually looks at all of the type of work that we've been talking about, where we've sort of got up to. So the integrating health into planning processes, looking at health strategies that Wallandilly want to imply. So we sort of started this working group. So we've got a terms of reference, we've got an established group, we meet regularly, and we report through the Wallandilly Health Alliance, so the top one. So we try to embed that so that it actually continues to happen, and we meet quite regularly. I think that's all I'll say, so we can move along.
I probably should have mentioned before, the first research project, the pathway for us was a memorandum of understanding between the council and the health service. But since then, because that health work is now embedded in the structure of our health alliance, we don't need a memorandum of understanding for the work that we're undertaking now. It sits under that, and I guess there's now that solid pathway to undertake more work without an individual agreement each time. So in terms of, I guess, how, we're starting to see, I guess, the outcomes of all this discussion. We've just spoken about the health and planning work, but in terms of local councils have a sort of corporate reporting requirements that all councils in New South Wales have to do. They have to prepare a community strategic plan and budgets and action plans and those sorts of things, for their political term. And Wallandilly's community strategic plan now has a page focused on sort of health and wellbeing, what it means for the council. But there's that, I guess, that statement and commitment in our very highest level of corporate documents. And at the moment, we're also exploring a joint position, who would have, I guess, knowledge in land use planning and in health, and to bring that person into our organisation to undertake, I guess, some of these health and wellbeing strategies that we've undertaken, any of the actions that come out of our research projects, commenting on development proposals, undertaking training, just to, I guess, what we've identified is a need to change the culture and build capacity.
UNSW is a very easy council to work with, can I just say, because they've already embedded the culture and the health. Like, I sometimes come along to meetings and just sit back and I just let it all happen, because I don't really need to say very much, because it's just so instilled already in the planners themselves. The beauty of the partnership as well is that every time that they want to put something on exhibition, they can ring me directly. I know them, they know me, and we just work through things. You know, I was even ringing Carolyn yesterday at 5 o'clock saying, who can I send this to? Where, you know, we're submitting something really late and we want to get it in. And it's just perfect. Sorry, Peter, I did send you that 5 o'clock yesterday, because Carolyn said send it to Peter. So that's the beauty. You know, like, this is, you know, you say you just do a HIA, but look how far it's gotten us in 5 years' time. I know 5 years sounds a lot, but we have just done so much in 5 years. Like, it's just great. So this is the value that it adds. You know, when I put this slide together, I was trying to think of, you know, the values that it adds to the organisation, to our LHD and council, but they're almost the same. Like, this is how good it is that we find that the HIA has done for us. It builds the skills and capacity for both of us. So in health, the people know how to do literature reviews even better, and so do the people in council. That's just an example. You know, healthy populations, healthy communities. Engagement and working relationships between the both, like we've been saying. Sustained relationships, that's very obvious that we've been still working together 5 years later. And understanding each other's processes, because can I tell you, that's probably the hardest thing that I've had to get my head around, is the processes and the people and the levels in council, because it's just so hard, you know, and they think the same with us in health. You know, a lot of people think that with health it's just hospitals, but, you know, Wallandilly council know that there's more than just hospitals in health. They understand our structures, we understand theirs, and they understand the social determinants of health really well. So just some tips from Tina, and then we're finished.
So these tips kind of evolved from our experience with the HIA, but now is sort of relevant to where we are as a working group now. So be clear about your expectations. There is going to be work involved, and so the people that are on board, they need to be prepared for that. They need to have buy-in from their managers and their managers, so that they're allowed to give them the space they need to do the work. Identifying a driver, we learned that through our HIA. Part of the reason it took so long was because different people jumped in at different points. So we've got now Peter and Maria driving our working group, and Maria's really good at keeping everyone on task, and so is Peter. And so the agreed milestones, we set our dates in advance. It sounds like a really simple thing, but everybody knows when the meetings are coming up, and they're prepared and they've done their homework, and they come to the meeting prepared to actually talk and discuss, not wasting time going through things. And we try to meet regularly as possible, and involving that range of stakeholders. So having that working group, we've got people from Primary Health Network, from Health, from Chetra. So we've got all those disciplines there, as also within council. We're building that constantly, so we're inviting people in as relevant to have those conversations. So it's really important, and also having the, as I said before, the buy-in from our senior management, both in health and also in council. So our general manager is really supportive, and that really helps us to get what we need to get done to get results. So that's about it. Some little kicks from our experience. This was our forum in 2015, and these are just some consultations as part of our HIA, and taking some time out from the HIA process. Thank you. Any questions?
Thanks so much. I'm just wondering, do people have any burning questions? Or otherwise what we might do is try and reserve some time at the end to have like a decent panel discussion, because I think there's a lot of commonality coming out through already the two presentations, and I'm sure we'll hear more. The next, so does anyone have any burning issues, or do you want to save it for the, okay, one question, you have one quick one?
Sorry, it's not a burning question. It's just something that I want to flag for us to pick up a little bit further. I'm Claire Wild from the Ministry of Health. This is the first I've heard about this. Fantastic work, guys, wonderful. But I'm involved at a high level on collaboration between government agencies, health, and we need to do something to broaden this out and step it up, because there's so much more work to be done under the GSE, the planning, the new LEPs, the new strategic statements of intent, all of that, we've got to take it bigger.
Good point. So I'll put that on the board as something to come back to, because I think there is the issue of local collaborations and partnerships, but how does it fit into a broader statewide agenda, and recognising that, you know, local government is local, but there's regional and statewide implications of this work as well. I think Jinhee's next, actually, Jane. Sorry, jumping the gun. So I'd like to welcome Jinhee Kim to speak about experiences with HIA at the municipal level in Korea. So Jinhee is she's a PhD scholar at the University of New South Wales, who's joined us this year from Korea. Her current research is actually focused on enhancing health equity through urban planning, with a specific focus on the southwest of Sydney. But she has a lot of experience in health promotion and the Healthy Cities movement in Korea as well. So over to Jinhee. Thanks.
Thank you. So I have just recently moved to Australia, and this is my 100th day, so it's a very good way to commemorate that. I'm here today to talk about HIA in Korea. I'm not sure how many of you are familiar with Korea, but if you go north and then a little bit to the west, there's Korea. And this is South Korea, and the little areas each represents a local council or local government. We have a total of 236 local governments, which sit under provincial or metropolitan government. So we have a central government, provincial and metropolitan governments, and 236 local governments. One thing that you need to know about the Korean system is that we have had this three-tier system for a long time, since since Korea was born, but we have a very strong central government, and the local government, the autonomy is fairly new in the sense that we only started to elect our local leaders starting from 1995. So there's still this culture within the governments that the central government still directs and gives funds and kind of leads the direction of the policies and the programs. And the local governments still look to the provincial or the central governments for guidance and directions. And this kind of runs through the health impact assessment and also in Healthy Cities as well. In Korea, so I think I was given 10 minutes to give you a brief introduction to Korea. Let me try. We have a few policy structures in place for health impact assessment. At the national level, we have the Environmental Health Act, and health impact assessment is also in the National Health Plan. The current plan hopes to have 100 local governments doing HIA by the year 2020. Which is a bit ambitious, considering that it's still under 10, I think. At the local level, there are some local governments that have local ordinances that would support Healthy Cities and health impact assessment. The interesting story about health impact assessment in Korea is that the start, or what kind of promoted it, is that in 2008, so the Ministry of Environment submitted a bill which was passed to include health impact assessment within environmental impact assessment. And this is 10 years ago, and I remember as a student, so one day my supervisor is like, there's this big thing going on, we need to stop this from happening, because if it is under the legislation that health impact assessment is part of the environmental impact assessment, that would limit so many things that the potential HIA would have as a tool for developing healthy public policies. Health impact assessment in EIA measures quantitative risks of air, land, and water pollutants. and it's limited to large-scale development plans, including industrial complex development plans or power plants or waste disposal facilities. So it is more in that area. So in 2008, the Ministry of Health reached an agreement with the Ministry of Environment to postpone the enforcement of this bill, that article, that specific article on health impact assessment until 2011. So we had 3 years to come up with a way of showing that HIA could be a policy tool for developing healthy public policies. So this role was given to the Korea Institute of Health and Social Affairs, we call it KIHASA, and it's a government-funded research institution under the Prime Minister's office. And KIHASA focused on local governments, especially healthy cities, and conducted a range of demonstration projects because HIA in this sense was fairly new to academics in Korea as well, so we needed a lot of demonstration projects to learn by doing. KIHASA also conducted a lot of capacity building and training workshops, and we did a lot of advocacy. We tried so many times to get health impact assessment in the national level law on health promotion, which did not happen to this day. There's a HIA depository online that KIHASA has set up. And also, KIHASA is part of the international network for HIAs and I think is an active member. And fairly recently, they developed a rapid HIA toolkit for local governments to use, and I'll talk about that a little bit in detail later. There has been a total of 27 demonstration projects, 20 projects in healthy cities, and the project areas include not only health, but in welfare, transport, education, urban planning, environment, and all the different areas of local policy programs and projects. There hasn't been a proper systematic evaluation of these demonstration projects, but and they're fairly anecdotal, but it is reported that 8 out of 10 HIAs that were followed up actually made changes as a result of the HIA. The HIA depository is an online portal that KIHASA has set up. It's fortunately for you, there's an English version. It's not as comprehensive as the Korean version, so if you're interested, you could go in and check it out. And they upload guidelines from all over the world. They make translations into Korean. They upload reports, HIA reports, and other related information on there. So recently, like I said, KIHASA developed a very practical toolkit for local governments, and it was in collaboration with Seocho-gu, which is a local government in Seoul, and the mayor of Seocho is promotes and is a very strong believer in healthy public policy. So they had introduced a local ordinance on health impact assessment, and together with KIHASA, they have developed a toolkit for local governments to use. And this is actually for the local government officials to use in their work when they're developing plans or programs. And it's composed of 3 standardized sections. And let me see if I can I get internet access on this? No, okay. So if you go in and if you look in the Korean version of the depository, there is a rapid toolkit for the local governments to use. And in the screening section, so for each plan or program, the officials submit, they have well, it is recommended that they use this to review their plan. So there's a place to do your screening to see if it needs a proper health impact assessment. And there's a checklist for impact in the 5 different areas of social determinants of health, and a short recommendations place. Some of the reflections from the Korean experience, in summary, I think is that we've had a lot of resistance from local government officials that this may be an additional burden to their already busy work. So one of the things that we tried to do was to make it very simple, easy, and make it similar to the already familiar gender equality impact assessments that are already in place at the local government level, so that they could kind of see that this is something that they're already used to. Yes, and strong and stable support from HIAS is critical in terms of providing technical expertise, funding, and also capacity building. And having that same group of people working on HIA for over 10 years is I think, a strong asset. Being strategic and creating synergy from trying to prevent HIA as within the EIA framework to expanding it to healthy cities was important as well. Some of the next steps maybe would be, we talked about learning by doing, but I think for Koreans, we should do more now and not, just stay at the learning phase. And of course, systematic reviews are needed, and institutionalization is very important, especially in the Korean context. And some more community engagement would be beneficial as well. That's it. Thank you.
Thanks so much, Jinhee. Similarly as before, I'll suggest that if there's any issues you'd like to put up here, now's a good time. Otherwise, we can revisit some of those experiences during the panel discussion. Thanks very much, Jinhee. That's fantastic. I'd like to introduce our final speaker, who's Associate Professor Jane Lloyd. Jane's the Director of the Health Equity Research and Development Unit, which is part of the Centre for Primary Healthcare and Equity and part of Sydney Local Health District. And Jane's going to be talking about the Green Square Health Impact Assessment, which was conducted by Sydney Local Health District in conjunction with the City of Sydney. And Green Square, for those of you who might not be familiar or on this live stream, is a significant growth area within the inner city of Sydney. So over to you, Jane. Thanks.
Before I start, I'd like to acknowledge the traditional owners on the land in which we meet, the Gadigal people of the Eora Nation, and any Aboriginal people in the room today. So Ben introduced me. I am the director of HERDU. I thought I would just explain to people live streaming, but also in the room, that these hubs that we have, so there's Tetra and there's Search and there's HERDU, which are based in different local health districts, have dual accountability. So we're accountable to the Centre for Primary Healthcare and Equity, which goes up to the Faculty of Medicine, but we're also accountable to the local health district. And in HERDU's situation, we sit under clinical services integration. We're very much part of Sydney Local Health District. And I also think it's important to reflect on health and what we mean by health, particularly because we're talking about working across, working in partnership and the roles of local government, because most people can accept that health isn't merely the absence of disease. The World Health Organisation definition, the Aboriginal definitions are different. It might be about spirituality is important to health and connection to land. For other groups, it may be family is really important. So health is a dynamic term, and it can mean different things to different people, and it's certainly more than hospitals and acute care and stopping people getting sick. And that's why we're here today, because it's not the responsibility just of the local health districts and the Ministry of Health to try and create environments for health. The community themselves, local government, other government agencies all have responsibility for that. I've got a long list of acknowledgements. How do I go back then? Okay. I'll start with Leila Consu, who's in the front row. Sorry, I didn't pronounce your last name correctly. Consu. She's the manager of the Green Square placemaking, and her predecessor, Morris Bellamy, retired last year. So I'd like to also acknowledge him. Acknowledge Liz Harris here in the front row, who was part of the team who did the HIA and the inaugural director of Herdu and also the inaugural director of Chetra. And also Eveline, who facilitated some of our discussions with the partners, and also Ben, who provided advice on the HIA and presented the results in Santa Fe. So, Green Square. Leila, chip in at any point if you want to add something. So it's a 278-hectare urban renewal project that's just down the road. It's halfway between here and the airport. It's got a value of $13 billion and a new population of 61,000 residents is expected by 2036. And Green Square is Australia's largest urban renewal project. In 2016, according to the census, the population in Green Square is 26,657. So you can see that's it's going to grow at least by 2/3 more. And so it's obviously high density. So what does living well at density mean? And how do we support the quality of life and well-being of residents when you're living vertically, if you like, and particularly children? There was used to be an assumption that children didn't live in high-rise, and there is growing acceptance that that's not the case, and it certainly won't be in the future. So the City of Sydney have a role, obviously, in the direct investment of the parks and the libraries and footpaths, but they also have a role in advocacy, working with local government agencies, which includes health, in terms of providing health services, but also in creating environments that are conducive to healthy living. And importantly, schools, having access to schools for people living in the apartments, being able to walk to those schools is important. Now, university I haven't talked about in great detail, but I think it's worth mentioning that the university brings that ability to collect the evidence and distill the evidence, but also on the process, having an evidence-based process to doing an HIA and learning from those experiences. So this is the Aquatic and Recreation Centre that's been created as part of Green Square. Other things that the local government, the City of Sydney, are doing, including a library, playing fields. And so these were determined, the need for these was determined at an early stage in the urban renewal process through a social impact assessment and also through a social infrastructure audit. So we did an HIA. We were asked by our Chief Executive to do a health impact assessment because it's new, isn't it, having this sort of density in our area. And so we did it as a decision support HIA that was coordinated by Herdu, but we had input from the Sydney Local Health District, planning in particular, Pam Garrett, and integrated care, of course the City of Sydney and CPHCE, and community organisations. So we had a governance process, which we met 3 times over the course, and we focused not on the whole renewal area, but on doing the HIA on the draft infrastructure and strategy and plan. So we wanted to know, through the HIA, were the direct and indirect health effects of Green Square, and also the strategy and actions to be taken, and to strengthen the way that the development can promote health and reduce any health inequalities. So are there any groups that are likely to be particularly disadvantaged from living in this development or living there as part of the construction? We focused on 4 areas, which were child health and development, transport, community infrastructure and affordable housing. So if people take a moment to reflect, how does that impact on your health and your quality of life? Does anyone want to make a comment about that? How in your work you think that any of those? So community infrastructure, the ability to interact might have an effect on your loneliness, which has an effect on your mental health, which has an effect on your quality of life. So you need the physical places to meet, but you also need the opportunities to meet, whether they're incidental or planned. Child health and development is important. Obviously, being able to walk to school or being able to walk places is important for physical activity, and not being exposed to traffic and pollution as a part of that experience. So we did 4 assessment reports based on those 4 areas, and we reviewed relevant policies, the literature, we had some consultations, and we interviewed key stakeholders. So I won't go through all the findings, but I will say, allude to some of them. So one thing with Green Square is that many people living in Green Square are renters. And this is a problem because of its location. It's quite close to universities and the city, but once somebody is living in a rental accommodation, what sort of legislation or protections are in place for them? And as housing becomes less affordable in Sydney, people are required to live not only in smaller spaces but with a greater number of people, so there's a higher rate of group housing and there's a risk of overcrowding. But there's also housing stress, as we've talked about earlier here, that if you spend more than 30% of your income on housing, that means you have less money for other things you might need in order to be healthy. One of the negative impacts or warnings around housing density is that what happens in an emergency, particularly if you have a lot of people in a dense environment, what happens within the buildings themselves, within the centre, but also across the whole renewal area. And there are obviously transport challenges that come from brownfield development sites. So this is my second last slide. These are some of the recommendations. So obviously with density, emergency preparedness is important, and there's a need for a comprehensive disaster management plan, and for that to be routinely tested and being linked to the state disaster plan. We need an adequate number of primary schools. So we need them. Ideally for health, being able to walk to school is important. If that's not possible, what else can we put in place to enable people to get to and from school with such dense living? And maybe Lily, you can talk about the role of the city in advocating for primary schools in the area. One of the interesting things, I think, is preserving pockets of land. As Sydney becomes less affordable and there's less space, how do we build schools? How do we build health services when it's so expensive to have land there? So, and we need community-owned facilities too, such as places of worship. So that's a responsibility of the City of Sydney and other government agencies who own land in Green Square. And of course, living on a building site and construction and the risk of exposure to dust, traffic, and getting across the area is a responsibility of New South Wales Health and of Sydney Local Health District and the city. So that's why I entitled the presentation "The Science and Art of an HIA," because it's a technical process, but it's also a technical exercise, but a stepwise process. And being able to advocate and work with multiple government agencies seems to be the fundamental basis of having an impact. And I wondered if we could just have a brief discussion, if that's okay, Ben, about the roles and responsibilities for health across the different stages of development by the relevant agencies. So there's the plan, there's the implementation of the plan, and then there's once people are living there. And maybe we could invite you to provide the first comment if you were able.
I suppose I mean, what I would say initially is that it's never too late to do an HIA or to do an assessment. The Green Square area has been planned from mid-1990s, and when you consider that in 1996 there were only 3,000 people, we're up to just 26,000 now, and the projections are for 61,000. So in this whole period, or this very long period of time, there have been many reviews and reflections on how the area has grown, what things we learned from the past and what we should do in the future. And I guess my main point is that having done the HIAs puts us into more of that reflection and review, and then to see from what we've learned and what hasn't happened and would have liked to happen, what we can do. And there are still, the area is probably 50% redeveloped, and there's still quite a number of areas that we have to do master planning for, and those areas are the ones that I see that will incorporate some of the outcomes of the HIA. One of the other major difficulties that we have is dealing with the state government agencies and getting everyone to work as one, as a united front, to get the best amenity for the large number of people that will live there. And we are slowly making inroads, and a very strong role is the advocacy that you mentioned, but it is now it's some of the issues to do with public transport and to do with congestion in the inner cities is something where we need strong action to happen, and we're working on that.
Terrific. I'm just thinking what might be timely now is to thank Jane for her presentation, but to move to a panel discussion. So, so could I invite all the speakers to come up to the table and join us? So everyone up off your chairs and join us at the table at the front. Maria, Tina and Carolyn? Yeah, all of you. Yeah. And can I also invite Professor Evelyn DeLeo to join them at the front? Professor Evelyn is Professor of at the University of New South Wales, but she's Director of the Centre for Health Equity Training, Research and Evaluation, which is the full name of this acronym Chetra you've been hearing this morning. So everyone please grab a seat. And so I might ask Evelyn to kick off with your reflections based on what you've heard this morning. So.
I'll position myself at the end over there so I can see everybody. But while I'm here, I've heard a lot, and just to reflect would take up the half hour that's left in our morning. There's only a few things that I want to say. One, incredibly pleased to see that HIA is alive and kicking, because occasionally we think it's dead. It is certainly not dead. It's alive and kicking around the world. And thank you, Tierno, for showing us that there's so many different ways of doing it, from different starting points, and with great flexibility. And that's also what we've seen over time in Wollondilly. So that's one thing. The second thing is that it's not just HIA as a tool to show what the impacts are of major changes on health in particular environments. What I'm impressed with is that HIA has a tactical value, that it brings together stakeholders, and that you do this over time, and the time scales that we've seen are 10, 15 years of persistent keeping going at the same thing, and that there are different dimensions of that keeping going that are important. Learning by doing, for instance, in Wollondilly. Jane He said something interesting about a new piece of legislation and someone saying, this is going to be a disaster, we need to do something. And then hitting at it for 3 years and saying, okay, now we need to have a thing that's called Kihasa, and they advocate at the prime ministerial level for this sort of stuff. And the same thing happens at the local level in Green Square. you try to build a level of intelligence that adds to the decision making that we are engaged in, not just as health people. And that's my last point. All of this is about brokering knowledge. It's not about knowledge translation. I hate that term. It is brokering knowledge, co-creating intelligence, how to act cleverly for health and well-being. I was impressed with Tierno's observation that health is not the outcome, well-being is the outcome. And health is just a thing that exists for some people in a silo, but well-being is what makes us tick. And all of your presentations reminded me of the fact that we are boundary spanners. In this business, we are boundary spanners. And at Chetra, but also at Surge and Herdu, I think we're privileged to be able to work across these different organizations, health, universities, urban planning. We work all with Aboriginal communities that we really recognize as important partners. And that brokerage, that boundary spending is the key of what we do. And that's why it takes time, but ultimately has some sort of impact. Maybe not directly on policies and politics, but through the tactical dimensions of what we do, we are making a change. So that's my reflection.
Fantastic.
Do you want to facilitate questions?
Yeah, I'll facilitate questions. So please join the panel, and I can carry mics around and so on. So, Peter, comment. And I'd also just like to remind people about our earlier comment, and if we can draw a comment back to some of what are the implications, not just at individual local government levels, but more generally and thinking of the ministry and statewide levels.
Thanks, Ben. Peter Wright from Wallandilly. So I'm directing my question not so much to the Wallandilly staff, because that wouldn't really be fair. But you might have some comments on it. But it's to everyone really, and maybe even Leela might have a comment on this. We've talked today a lot about how this is very much a partnership between town planners and public health and breaking down the silos between those two. But there is, of course, a third player in the whole dimension, and that's the private development industry. I'd like to hear some comments and experiences about what people think. So the Quebec experience and the Korean experience and the Green Square experience on the degree to which the development industry has an awareness of HIA or health generally, and the degree to which they're embracing it positively. So that's my question. I hope that's clear.
Please, would anyone like to chip in? TNO, do you have any reflections, or Jen here particularly? Jen, different context.
Well, in the context of Korea, especially within HIA within EIA, because it's part of the legislation and it's statutory that when developing large-scale development plans, it's by law. But again, in Korea, it's very centralized, and regulations would direct how people do their business. But apart from those strong regulations, we do still have the same struggles to try to get the private developers on board. I think still the most effective way is to do it is by legislation or regulation.
Yeah, thank you for the questions. I think I have another point of view about that situation. In Quebec City, HIA is currently done on a voluntary basis. It's not in a legislation. We have the situation in Switzerland in the Canton of Geneva, where in the public health law there is an article about HIA, but we realize that this is not. I don't think that this led to many HIA, because there is another canton in Switzerland which is doing HIA in a voluntary basis, and they have more HIA done than the canton of Geneva, whereas this in a legal basis. And Quebec City right now, what we are trying to do is to get involved in the process in the HIA, provide the private company, the promoters. That was my my first time to seeing them involved directly in the projects. And that's why I remember that we are confronted in a kind of situation where we had a lot of potential negative impact of a project, but the promoters were in the process. And they accept the result of the HIA because they were in the process, and we have the opportunity to discuss with them, to explain to them why the impact are potentially negatives and why it's like this. And they were very satisfied. Actually, we were surprised because usually when you told them that your project is quite negative, they will be a little bit reluctant. But they were very, very satisfied. Then our solution is to bring them in the process and to work with them.
Evelyn, do you have any reflections?
Yes. I think this is a critical question, because that's where the tension exists. I should say that CHETRA is based in the Ingham Institute for Applied Medical Research, and the Ingham Institute is a philanthropy, for what it's worth, run by rich people, chicken millionaires. And our chicken millionaires deal with other millionaires in the development industry. And the people who run Ingham are constantly in my office saying, there's an opportunity here. We can sell this to these people. And last Friday we launched the Urban Health Incubator, which is a space where the different stakeholders in urban development and health supposedly have an opportunity to meet. Ingham sees this as a money-making enterprise. You become a member of the Urban Health Incubator and you start discussing with experts under Chatham House rules, and we would all be very happy. And last year I was approached, in fact, by a consultancy firm who said, we can commercialize HIAs. There's a lot of money here to be made. And you can imagine that we are a bit, no, not just a bit, we are quite hesitant when looking at commercial opportunities for HIAs. But it is something that is definitely on the radar of commercial operators, maybe not necessarily on the radar of commercial developers.
Can I pose a related challenge? Is more HIA better? I'd like to just also recognise that in the room we've got quite a lot of HIA experience, probably around 100 HIAs people have been involved in. But I would like to acknowledge also Liz was instrumental in starting HIA practice in New South Wales. So first starting in 2003 through work funded by the Ministry of New South Wales, Ministry of Health in New South Wales. Did you have any thoughts about what you're hearing about the commercialisation and so on?
I think there's, because it's an under-resourced area, so all of the HIAs are really reliant on the support of local health districts at the moment, whereas, when we first started, we were given substantial funding from the department, but eventually that dried up. So the question being, is more better? I think that depends on whether you think it's worth doing. Like, it's not worth having more things that have no use. But our sort of evaluation showed that by and large, most HIA do have an effect, a positive effect on policies. I do think that when you're talking about urban development, one of the things that I've observed is that, we always talk about capital as being a driving force of social determinants of health. And there's no doubt if you're sitting in a room with the people who are developing Green Square or Waterloo, you are face to face with capital. And capital has a different set of values than most health systems. And so I think there's a challenge of how do we bridge that difference. We need to bridge it, but how you do it, I think, is the next challenge. Because there's no doubt that most HIAs in Australia and New Zealand are done on land use planning. And land use planning of its very nature involves developers. And so how do we work effectively with developers? It's not confrontational because it, you know, and I don't know the answer, but I know it's the critical question.
Do people on the panel have any reflections or thoughts based on that? Sorry.
Just a thought on that. That was a really interesting comment, but just the reflection on the commonality between where the developers want to take something and where HIA wants to take something. And Chiana's presentation, the ultimate aim was about quality of life, and to some extent the development industry are trying to sell quality of life. That's what they're trying to make money on, and there's some ultimate commonality there. So that's just a reflection. At the end game, they're trying to make money out of selling quality of life, and HIAs are trying to derive community benefit from quality of life. But there's some common language there and common goals.
Any immediate thoughts or reflections?
In terms of the Green Square experience, and this is that an area would not develop unless the development industry is there, because it's really at the time of a development application where activity happens, unless council or other organisations own land. But certainly in New South Wales, that's how it happens. So from the Green Square experience, I think it's very important to have from the very early days the right planning controls and to plan an area, to master plan an area so that it can incorporate those elements that, like walkability, permeability, that at the end of the day are going to make a difference in the amenity and the livability of a place. And I think that the problem is that that takes time, and it's really to work down to a great level of detail. So when a development application comes to the council, that application can be assessed on the basis of that framework, those controls that will deliver a better environment.
Any thoughts from the panel?
I guess there are developments and then there are developments, and urban renewal and public housing, and Waterloo is one that's close to here physically, and so I think that quality of life question, Peter, it's about that is common language, but quality of life for whom and when. Like, you know, how long does it take? And so for public housing, the current residents, obviously when you hear about the development, there'd be the anxiety of knowing that it's coming, it's during the construction phase and being moved or not being moved, loss of networks and things. And I guess there's quite a big power imbalance. So between the public housing residents and the private tenants that come into these developments, but also the developers themselves. So, you know, the Centre for Primary Healthcare and Equity has equity in its name, and so we do care about the distribution of those determinants and whether that's fair or not. So we would be wanting to do HIAs, I think, that have that an equity lens. And so perhaps as there's more urban renewal of public housing estates, we should be doing more HIAs with an equity lens to support that part of our population.
Because we have had a specific focus on local government today, but there's a lot of overlapping intersectoral areas. And maybe to pick up on your earlier point as well, where I invite you to comment further, but maybe, you know, what are the opportunities thinking of other agencies and, you know, state levels and so on?
Yes, I've come from a meeting this morning of the senior officers of the Greater Sydney Commission, and they're looking at the implementation of the district and the regional plans, but they also are involved with future transport. And what's going on at that level is that they've made a whole lot of government policies around development growth. I mean, it's very much about growth all across not only the City of Sydney, the Greater Metropolitan Sydney, big plans for the Western Sydney City Deal, but also right around the state in the regional plans. So what we have is a kind of government notion that we're going to have growth, population, housing, jobs, and by the by, we'd also like some healthy living outcomes as well. it's a little bit kind of ancillary rather than a core focus. But they are also got an emphasis on placemaking, and to me, placemaking is a really important kind of hook on which to incorporate healthy outcomes and quality of life and well-being. And they do talk about opportunities, proximity to transport, proximity to open space, housing affordability, all of those things that have come up, particularly in those couple of presentations on HIA. So I think what I really would like to see is a way that your voices and their voices and their endeavours can come together in a really meaningful way. And I'm not quite sure what that meaningful way is. But
So any thoughts and reflections first, and then I'll come to Damien. Any thoughts from the panel in response? As placemakers yourself?
I think we lost a big opportunity recently when they reviewed the planning legislation, the Environmental Planning Assessment Act, and the final act did not have health as one of the objectives of that act in it. And I think that was a real loss.
Hi. We've heard from the speakers about the importance of collaboration and partnership between everyone who's involved in the health and impact assessment process. And part of that collaboration and partnership is between local government and, provincial or state government. So in Green Park or any of the other projects like Wollondilly, has there been any tension between local government and state government? I used to live near Green Park in Alexandria, and so I'm familiar with the area, and I'm familiar with the anxiety around WestConnex and the environmental and health impacts that WestConnex is going to have for the people of Alexandria, Green Park and that area. Is WestConnex part of, the larger Green Park plan, and was anyone who was involved in WestConnex collaborating with the people who were developing Green Park, or was that a City of Sydney responsibility? So what I'm trying to sort of figure out here is who's in charge, who drives the policy decisions, who wins if there's a tension between local and state government. And if you're aware of an example, could you give one?
That's a great question, Damien, and gets at the guts of the tension that many colleagues in local government routinely have to deal with about, decisions that you're having to deal with about infrastructure, public transport and so on are often made at different, levels or realms of government. Is anyone brave enough to comment on that? Or?
I'll go. You go first, Lila, if you like.
Certainly, WestConnex is not a City of Sydney project, and the council has very strongly opposed it because of its impact on health, the number of cars that will come to the area, and the dissection of the Green Square area will be a major east-west route. I think now the plan is for 6 lanes, 3 each way. But it's a project that is going ahead, and we strongly objected to it, and we've objected to the impacts. But because it's going ahead, our challenge is how can you make a really bad situation better? By way of design, how can you improve for example, the green space around it? It will have a devastating impact on the area. And we're still, actively objecting to it. But it's one of those things that it's a project that's been planned for a long time, and it's in terms of who wins council of or state government, it's a difficult one because we'd like to work in collaboration with the state government, but sometimes it's very difficult because some of the projects are very difficult to stop.
So that's a tension at the planning level. So,
I was going to say, Wallandilly Council currently has an advocacy campaign regarding the Wilton New Town proposal called Wilton, a Great New Town or No Town at All. And that's come about because Council's not the consent authority for that development, and the Department of Planning has gone ahead and released one portion of the proposal against Council's, with concerns, expressed concerns from Council. So our councils have decided to withdraw their in-principle support. We want to see Wilton be a great new town, but we have a number of sort of unanswered questions. At the moment, our focus is on koala habitat, and we're actually trying to get 10,000 signatures, which I should have brought today to get some here, to take that to the Legislative Assembly and have that discussed in Parliament. So we're really concerned about because initially when you look at the Wilton Junction Master Plan way back in 2012, the principles were there, and the lifestyle and all that, and that those, as Peter alluded to, the marketing interception points in terms of like how can we make this a great place, work with the developers about making money, but let's make it a fantastic place to actually live, not just a bunch of houses where 20, 30 years down the track we're going to have lots of social issues there. So in terms of who wins, we're obviously as I said, we're not the consent authority, we're a little fish, but we're stamping our foot at the moment, and I guess it's a wait and see. I don't know, Peter, did you have anything? Yeah. Yeah.
Aiming to win.
Yeah.
That's good. And is this just a peculiarity of the Australian setting, the tension between local government and state or provincial agencies, or is it familiar in Quebec or France or Jinhee in Korea? Is it our unusual governance arrangements with 3 levels of government that people are routinely dealing with, or are these issues familiar?
Not so much. As I said earlier, we still have that culture within the 3 tiers of the government that the national government would give the overarching goals and the direction, and they also provide the budgets and all that assistance and support. So there's not as much tension that I am aware of, especially. Of course, there are oppositions, but generally I think when the provincial level develops a plan or project, it's pretty much put forward.
People line up behind it.
The situation in France is that it's a centralized state and everything is controlled by Paris. Then the situation is a little bit different. But the situation that we have in Switzerland, actually, there are kind of very different situation between cantons and the federal levels. We were expecting, at the federal level having the Health Prevention Act, but the Swiss Parliament has rejected the Health Prevention Act. Then HIA was kind of dead at the federal level, and we are still trying to keep it alive at the cantonal level. But in Quebec, in Canada, I haven't seen, I don't know exactly the situation at the federal level, but at the provincial level and at the local level, there is not so much difference between local level and provincial level for the province of Quebec. Yeah.
I think we're straying into one of Evelyn's favourite topics, which is governance, and if you have any reflections. But also I think what we're sensing is there a role for the health sector to be an ally for local government in many of these quasi-advocacy activities as well?
Absolutely. The health and local government is a natural alliance. All over the world there is this recasting of the center of gravity when it comes to decision making and governance, and especially since the Habitat Conference, which recognized that we live in an urban world and that local governments actually should control the health and well-being of people. There's hundreds, if not thousands, of mayors who have committed to doing things better. Recently there was a Copenhagen consensus. Last year there was a Shanghai consensus. So local governments, local councillors, local mayors, they come together and say, we should be in control. We are close to our people. Samuel Barber, who wrote a book called If Mayors Are in Control, says, well, local government collects the garbage. That's not state government or national government. So at the local government is where it happens. That said, I think, and I'm not speaking about all of Australia because every state or territory has its different ways of organizing things. And in Victoria, for instance, the Municipal Public Health Plan, the Health Act, requires local governments to make health plans. Now, that is not a great success either because of incredibly short electoral cycles. How can you make a health plan in 3 years? But last year we wrote sort of an encyclopedia on healthy cities, looking at local government and health around the world. And I honestly must say that New South Wales probably has one of the most perverse planning systems in the world, where some authority, and often a lot of people don't even know who exactly that is, can decide to put 12 lanes of highway right through a local community. And how to stop that. And it is our role, health people, not the biomedical people, not the hospitals, it's the health people who would be able to assist and align ourselves better with local government, with local communities, and do the politics of this better. Because what impressed me about everything that you said was that you're doing politics. Tierno saying, talking to a politician who said, I don't want to have a big red minus, and then saying, well, I do a little triangle, is that okay? That's politics. And that's a game we can play. Aligning health impact assessment and health at a prime ministerial level through KIHASA, and then impacting on how local government might well implement things. That's politics. What we need to learn is how we elevate that into a standard repertoire. This shouldn't just be happening spontaneously. Well, it should also be happening spontaneously, but we need to learn from it. And one of the things that I'm really curious about, and I haven't seen any good research into, is both Tierno and Jin He reflected a little bit on this. How many of those health impact assessments have actually led to policy change? Because that's the ultimate goal. We can research whatever we want, but does it make a difference? Yeah. And we need to know where it happens and why it happens.
So some great points that you raised. I think in New South Wales we can be proud to be a world leader in perverse planning systems. So that's great. I think in response to your question about demonstrating the change, it's a great challenge to the field. And in the ARC study that Liz led a few years ago, looking at all the HIAs that have been conducted in Australia and New Zealand, found that all could demonstrate some change, but as always the issue of attributions are fraught one, and also the level and extent of change can be quite varied. So that is one of the great challenges, as you allude to. Are there any final comments or thoughts from the floor? We're just about out of time. Maria,
and then, I'll just quickly add something. I just wanted to make sure that everyone sort of thinks that when we think about stakeholders and who's part of the HIAs, that for us, we did a HIA recently that Chetra did with us, was for Ayers Bradbury, and that was a social housing redevelopment. And part of our working group were actual community members. And I just want to acknowledge them and their input, which makes a huge difference. So not only does, they were actually giving us so much information that we would never have known between planners and people in health and housing, actual people that work, like the professionals. The community, from social housing, were the ones that gave us the most enriching information that helped us come up with the recommendations. So I just want to throw that in the mix.
Just one final comment about the politics. I think that there are some people on the right, whether it's state or federal, who think that health impact assessments and any kind of environmental and health protections are red tape and bureaucracy. And we've seen that with the Murray-Darling plan, we've seen it with a number of environmental issues, koala habitats and so on. So I think in terms of winning people over and getting them on your side, Peter's right. If you do a really well conducted health impact assessment and you get a healthy community, a vibrant community with really good quality of life, then that is something the developers can sell, and they can use that as a case study. Green Park in 10 or 15 years, I don't know which developers involved, but if it works out well, they can point to that and they can say, we built that. I mean, obviously there was a large team of people, collaborators doing it, but I think if we can, convince developers that they have a benefit in a well-conducted health impact assessment, then everyone wins.
Fantastic final comment. I mean, does anyone have any closing thoughts? Okay, well, as usual, we could probably spend, 4 hours, 5 hours rather than 2 hours, but I think this has given us a really solid grounding of the work that's happening in Sydney and internationally on the promising, and I think Evelyn said it best, the natural alliance between local government and health, and the role that HIA can play. I've jotted down some ideas. There's some really interesting points that you've all raised about bridging those values differences, bringing people together, reconciling the tensions between the different levels of decision-making and resourcing that often all of us are grappling with. Quality of life and, the critical issue from an equity perspective of for whom, when and how. And I think, what role can we play as local government or as health sector people to back each other up? So there's processes that we can each usefully play a role in supporting. So thank you all for your time today. I'd like to particularly thank all the people who spoke and the panellists today. Please hang around and stay in touch. So thank you.